A concussion is technically a mild, uncomplicated traumatic brain injury. Usually it's something that happens in either the sports or the trauma setting, and typically we focus on more of the sports side of concussions at EmergeOrtho. Within the sports population, we typically see concussions happen as a result of direct contact, whether that be in football or indirect impact, which you can see in cheerleading. Important signs and symptoms to recognize for concussion include things like a blank or vacant stare, difficulty with balance, gait and coordination, blurry or double vision, disorientation or confusion, nausea, vomiting. Those are some of the classic signs and symptoms that we'll typically look for in the athletic field. Symptoms do vary quite a bit between different ages or patient populations and different sports as well, but it's really hard to predict how somebody will manifest their concussion, what signs or symptoms they may be experiencing. In general, younger children, adolescents tend to take a little bit longer to recover from a concussion than do teenagers or the adult population. But then even the elderly tend to take longer than that to recover from their concussions as well. The immediate response by coaches and trainers should include first identifying the athlete with a concussion, looking for those classic signs and symptoms, and then removing the athlete from the field of play for further evaluation by the athletic trainer or by some other qualified provider. The diagnosis and evaluation of concussion may occur initially on the sideline if it's identified at that point, but could potentially take place in the office setting. We use things like the SCAT-6 or the Sideline Concussion Assessment tool to be able to evaluate athletes on the sideline to evaluate for a concussion. And then in the office, we use tools like the SCOTE or the Sports Concussion Office Assessment Test to be able to evaluate and diagnose a concussion. Typically, a concussion is more of a clinical diagnosis. We don't expect to see any structural findings if we were to get any kind of imaging like a CT or an MRI of the brain. The recovery for concussions can be a little bit varied from individual to individual, but in general, we tend to follow a pathway where we normally prescribe cognitive rest for that initial 24 to 72 hours. Once we have gone through that period of cognitive rest, then the next phase kind of focuses more on the signs and symptoms that patients are dealing with. We initially start with a return to learn protocol for athletes that are still in school, whether that be high school or the college level, or for adults, we focus more on accommodations for work. So potentially starting at part-time level or reduced responsibilities and gradually kind of ramping things up as patient signs and symptoms tolerate. The long-term effects and risks that we worry about for a concussion are things like chronic traumatic encephalopathy, or CTE. That is a post-mortem diagnosis, so something that is diagnosed after a patient has unfortunately passed away, but it is something that we're concerned about for patients who have sustained a number of concussions and may have less of an impact that is potentially causing their concussions going forward. Another concern we have is something called second impact syndrome. When a patient hasn't completely recovered from their initial concussion and sustain a secondary concussion, it can lead to a lot of vascular changes in cerebral edema, which can lead to a lot of severe neurologic deficits and even things like death. We typically see concussions in contact sports, particularly in the competition setting, although they can occur in practice as well. And most of the time this occurs as a result of direct contact, similar to football or wrestling, but we can also see concussions sustained as a result of indirect contact, things that can happen in sports such as cheerleading as a result of a fall or hitting their head on the ground. Age has a significant effect on how we manage concussions. Children and adolescents tend to take longer to recover from concussions, and they also have unique obstacles to deal with, such as managing concussions while they're having to deal with school or their home life as well. For student athletes in particular, we have to talk about things like a return to learn and return to play protocols. So those are trying to reintegrate an athlete or a student athlete back into schoolwork gradually without exacerbating or worsening some of their symptoms. And the same thing goes for a return to play protocol as well. Return to play protocols primarily focus on ramping up the level of activity that a student athlete is going through. So we initially start with more cardiovascular or straight line running, just to be able to get the heart rate up and see if a patient is able to tolerate the symptoms and make sure that we're not exacerbating any symptoms. Then from there, we focus more on multi-directional cutting movements and then proceed to more sports-related activities. And then following that, start to reintegrate some type of contact activities before we fully jump back into competition. The biggest thing that we focus on in preventing concussions is proper form and equipment, using helmets and making sure that they are fitting properly, and then also teaching the right technique for tackling or other contact activities as well. Other things such as mouth guards can also be helpful in preventing against dental injuries and hopefully reduce the number of concussions. At EmergeOrtho, our goal is to build awareness of concussions and identify them early, and then help to build awareness surrounding concussions, to have student athletes or patients be transparent and honest with us about their signs and symptoms so that we can manage them accordingly and get patients back to whatever they would like to be able to do.